Hello everyone, my name is Nabila Akhtar from UNI School of Professional Studies. Today I'll be presenting my project for Mastery Number 1 using Social Explorer to analyze COVID-19 pattern across the United States in 2021. This project used spatial storytelling to explore how geography shaped the spread, impact, and response to the pandemic. Here is my introduction part. I used the 2021 coronavirus case data from Social Explorer and focused on three cumulative indicator, confirmed case, date, and vaccination. This indicator helps show the overall impact of COVID-19 across the lower 48 US states. Each map is deployed at the state level to allow consistent comparison and highlight large-scale region trends. Though this visualization, I aim to tell a data-driven story about how the pandemic evolved and how state-level difference influenced public health outcome. So I'm going to another slide, map 1, cumulative confirmed case rate per 100,000 to 2021. This has map used a shaped area tropad style to show cumulative confirmed case per 100,000 residency. The darker shade represents state with higher infection rate, while lighter shades show state with fewer cases. We can see the southern and western states like Texas, Florida, and California show darker coloring, meaning they had higher infection rate in 2021. These regions have large population, major travel hubs, and more mobility, which likely contributed to faster spread. This map captures the scale of community transmission across the US at the height of the pandemic. I'm going to another slide, map 2, cumulative death rate per 100,000 in 2021. This second map also used a Chopard style, showing total deaths per 100,000 residents in each state. Notice that southern states, particularly Mississippi, Alabama, and Louisiana, are the darkest, showing the highest death rates. This suggests that although infections were widespread, some regions suffered worse outcomes. Contributing factors may include limited access to healthcare, higher rate of pre-extension contraction, and lower vaccination rate. This map highlights how social and health equation translated into different mobility outcomes. Here is my slide 5, map 3, cumulative vaccination does distribute as of October 2021. This third map visualized cumulative vaccination does distributed per 100,000 residents, again using a shaded area map. Here we see the northern states like Vermont, Massachusetts, and Connecticut, with the darkest shade indicates higher vaccination coverage. In contrast, southern and some western states largest behind, which align with earlier maps showing higher case and death rates. These different reflect variation in public health policy across and community trust. The map visually reinforces how vaccination efforts were uneven across the country. So I'm going to slide 6, story and patterns. Looking add all three maps together, we can tell a clear story. COVID-19 affected every region of the United States, but the severity and response varied dramatically by state. Areas with lower vaccination rates tended to have higher case and death rates, especially in part of South. Meanwhile, northern states which had stronger vaccination contagion saw fewer deaths relative to their case number. This shows how public health preparedness and community cooperation can make a measurable difference. So I'm going to end the slide. Limitation, MAUP, and ecological fallacy. However, these are some key limitations. First, the MAUP or modifiable area unit problem, meaning that using state level data hides smaller local variations. For example, Los Angeles and rural Northern California look the same on the map even though their conditions are very different. Second, the ecological fallacy warns that we cannot assume individual behaviors from state average. Just because a state has a low vaccination rate doesn't mean everyone there is unvaccinated. Additionally, cumulative data doesn't show when surges occurred, and difference in reporting method may affect accuracy. So I'm going to slide 8. In conclusion, spatial analysis helps make complex public health data more understandable. By mapping COVID-19 case, dates, and vaccination, we can see how geography, policy, and behavior interacted during the pandemic. The map reminds us that pandemics are not only biological, they are also social and geographic. Understanding these spatial patterns can help improve public health preparedness for future crises. Thank you so much.